Hi, this is Logapriya, Assistant Professor, Department of Artificial Intelligence and Data Science, Ramco Institute of Technology, Rajapalayam. Let's have a intro about healthcare analytics. It's all about turning the healthcare data into insights which helps the doctors, hospital, institutes, policymakers for making better decisions and for both patients and the system. Definition for the healthcare analytics is which is a process of collecting, analyzing, and using the healthcare data for making a better decision in patient care, hospital management, as well as in public health. Healthcare analytics is mainly used for advanced computing technology to improve the medical care, which involves systematic examination, interpretation of healthcare data to extract the meaningful sites and identify the patterns for making the informed decisions. The main aim is to improve the outcome, reduce cost, and to ensure the quality. Let's see about the healthcare outcomes. It involves survival rates, increases and decrease the disease progression. Hospital readmission rate will also be checked, and recovery time is also get increases, improve the quality of life, and patient satisfaction is also increased. The next thing is it provide accurate diagnosis and effective treatment can be provided, no complication, and overall improve the quality of life. Let's see the importance of healthcare analytics. The first thing is improve patient care by identifying the opportunities which enhances the quality and effectiveness of healthcare services. And the second thing is managing the cost. By controlling the healthcare costs, we can easily identify the inefficiencies, fraud, and areas for the optimization. The next thing is public health planning, informing the public health strategies, interventions, and policies to the people through data driven insights. And the next thing, which helps decision support for the medicos by providing a stakeholders with evidence based information to support strategic decision making in healthcare organization. The next thing is foundation of healthcare analytics, which makes a base for for healthcare analytics is which is an integration of three fields like healthcare, mathematics, and computer science. The next is key components: data collection, processing, statistical analysis, and data visualization are the key components of healthcare analytics. Let's explain it by one. The first thing is data collection, gathering a relevant data from a various sources, which includes e-health records, mediscripts, claim data, patient surveys, and other healthcare databases. The next thing is we want to filter it by cleaning the unwanted data and maintaining the needed data and organizing and transforming the raw data into a format which is suitable for the analysis, and then addressing the missing values standardized format by ensuring the quality. The next thing is we want to analysis based on the statistics by applying all the statistical method to understand the relationship, trends, and variations in healthcare, which include descriptive, inferential, as well as predictive modeling. The next thing is to be visualized. Visualization is a process which is easily understandable to the users, that is client like medicos, presenting the complex healthcare data in a visually understandable format such as charts, bar graph, and dashboards to aid decision making and for easy communication. And the next thing is what are the types of healthcare analytics? It is classified into four as descriptive, diagnostic, predictive, and prescriptive. First thing is descriptive. In this, we can get the monthly report based on their admission, readmission rate, or disease case. Let's see how it can be ready. Examining the healthcare data to summarize and describe the patterns such as demographics, that is non-clinical data, like written prescription or whatever the patient's handling data, disease prevalence and healthcare utilization come under this analysis. Example, monthly reports on patient admissions and readmission rate or any disease cases. The second thing is diagnostic analysis. In this analysis, why a hospital has this type of infection rate, how this high infection rate is happening there. Likewise, we are identifying the cause for the specific healthcare outcomes or issues, often through advanced statistical methods to uncover the correlations and relationship. The next thing is predictive analysis. In this, we are predicting the developing chronic diseases or upcoming chronic diseases for a patient based on the historical data or the genetic data, using the historical data to make predictions about the future health trends patient outcomes, and resource needs, predicting the patients at the risk of developing the chronic diseases. The last one is prescriptive analysis. Based on the recommending actions, analysis findings to optimize the healthcare process, resource allocation, and overall performance. The best treatment plan is recommended for the patient based on their history and the data patterns. The next thing is applications. First thing is clinical analysis. In clinical analysis, analyzing the patient data for decision making and for personalized treatment and to improve the patient outcome. The second one is operational analytics, optimizing the efficiency of healthcare operations, which include resources like medicine, drugs, staff scheduling, and facility management. The second thing is financial analytics, managing the healthcare costs, billing process, insurance claim, reimbursement, that is compensation strategies through analysis for a financial data. The last one is population health management, studying the health trends and patterns within the specific population or a specific region to improve the overall community health. What are the challenges faced in maintaining healthcare analytics? Is first thing is data privacy and security, ensuring the confidentiality and security of sensitive health information, that is on patient data. Sensitive information of patient data is maintaining is a very complex one. Next thing is data integration, dealing with disparate data sources and integrating them for a comprehensive analysis. Interoperability, which ensures different health care systems and technologies can exchange and use the data seamlessly. Let's see the history of healthcare analysis parameters based on the medical care system, which is an evaluation of key indicators and metrics used to assess the performance, efficiency, and outcome of healthcare system. Over a time period, identification and measurement of these parameters played a crucial role in evaluating the effectiveness of medical care delivery. Here we come across the historical development of healthcare analysis parameters. The first thing is early foundation, that is pre 20th century. In pre-20th century, healthcare decisions were largely accidental or based on a trial and error method. It doesn't have any evidence basis. Data collection was minimal, relying mainly on individual patient records kept by the physicians itself. The second one is in the 19th century, rise of public health statistics, which lay a foundation for the modern healthcare system, begins with pioneers like Florence and Nightingale, who used statistical diagrams to improve sanitation in military hospitals, and government started tracking a vital statistic, birth rate, death rate, and which is mortality rate and maternity death rate, and laying the groundwork for epidemiology. And next is in 20th century, which is institutionalization of data. Hospitals and insurance companies began maintaining for more formal medical records. In 1980s, health management information became more common in hospitals. The next thing is emerge of health informatics, that is happened in the period of 1919 to 2000. In this time, e-health records, that means electronic health records growth, revolutionary data collection and accessibility. Advances in computing allow for more complex analysis, including predictive modeling. In that time only, organizations like WHO and Center for Disease Control and Prevention began leveraging the data to manage the global health issues. In the modern era, 2010 to present, big data, artificial intelligence, and machine learning have transformed the healthcare analysis to real time. In real time, analytics are used in patient monitoring, outbreak tracking during COVID 19, and treatment optimization. Healthcare analysis is now become a critical part in every delivery, policy making, and research. And then we go out to healthcare policies. Let's see. Everything has a set of rules and regulations to be followed while it become a policy. Likewise, healthcare also. Healthcare policies refers to a set of rules, regulation and laws, guidelines which governs the delivery on organization in healthcare services within a country or a particular region. These policies helps to achieve specific goals and to improve the quality of care which ensure accessibility, control the cost, and address public health issues. Let's see what are the type of healthcare policies. First thing is public, second one insurance and clinical and care and pharmaceutical policies. First thing is public. Public in the sense deals with the population, that is crowd wide effect, which comes under the vaccination program, disease prevention, health education. Before, prevention is better than cure. It's the policy based on public health one. Next one is insurance and financing policies, focusing on healthcare coverages, that is Medicaid, Medicare, insurance policies, which comes under this public and private health insurance, which also comes under this insurance and financing policies. Next one is clinical and care delivery policy, governs standard of care and provide a regulation and hospital operations. Then next one is pharmaceutical policies, involves regulation of drug pricing, development, approval and distribution, even from a large industry to the pharmaceutical pharmacies. The next one is what are the key aspects and consideration of this healthcare policies. Let's see one by one. The first thing is access to healthcare, because it is easily accessible to all the individual. The policies must be easily accessible by all the individual. That is the focus on ensuring the individuals which has a equitable access to healthcare services, which measures to reduce the barriers to entry, such as financial, economical, that is financial and economical, geographic, and issues related to cultural or linguistic differences. The second one is health insurance and financing, which is a major issues addresses by all of the patients. Like we want to overcome we overcome by these policies by using the healthcare insurance coverage and financing, which involves creation, regulation of public health insurance, subsidies, mandatories, or private insurance coverages. Next thing is quality of care. Quality of care in the sense which includes standards for healthcare providers, accreditation process, mechanism for monitoring and enforcing the quality measures. Next one is patient safety. In this, initiative and regulations are often taken to ensure the patient safety, which involves the measures to prevent medical errors, reduce hospital acquired infections, and promote overall safety in healthcare settings. The next one is initiatives of in public health, which comes under the border, which is mainly designed to address the border public issues like between the two states or between the two countries. This includes initiatives to control the spread of infectious disease from promote and to promote vaccination, regulate food and drug safety, and implement preventive health measures. The next one is workforce regulation. Policies govern the education and licensure to practice of healthcare professional, which includes regulations for physicians, nurse, pharmacists, and other healthcare providers to ensure the competency and to maintain the professional standards. The next thing is health information technology, which related to adoption and the use of health information and technology are crucial in modern healthcare landscape, that mainly involves the regulation for e-health records, interoperability standards, and data security and privacy measures. Next one is cost containment, because cost is a major thing we are all enclosing it. So, healthcare policies often aim to control the cost and make healthcare services which is really more affordable to all the peoples, which includes measures like price control, reimbursement strategies, and initiative to promote cost-effective care. Next thing is mental health and substance abuse. In this, policies can address the mental health and substance abuse issues, which includes the regulation for provisions of mental health services, insurance, and efforts to reduce the stigma, that is negative effects from that. Next thing is global health. Some policies extend beyond national borders to address the global health issues. Participation in international health organization, coordination on pandemic responses, which to address the global health challenges. The next thing is standardized set code. Standardized set code is healthcare refers to established universal accepted code used to represent the concept, procedure, diagnosis, and medication in all over the world and other health related informations all over the world. It is a crucial in healthcare, ensuring interoperability, accuracy, and consistency among different systems and in all the healthcare settings. Let's see one by one key standards widely used in healthcare. First thing is ICD, that means International Classification of Diseases, which is used to classify the diseases and health related condition. This code is mainly for the classification of diseases. And then common languages, which provide a common language for reporting a disease and health condition on health records and statistical reports. The versions are commonly used is ICD 9, 10, 11 are most commonly used versions. And second thing is CPT, which abbreviated for Current Procedural Terminology, a code developed and maintained by an American Medical Association. It is to describe medical, surgical, and diagnostic services provided by a healthcare professional. The main usage of CPT is in United States for billing and documentation purpose. And the next one is Healthcare Common Procedural Coding System, HCPCS. The purpose is mainly used for billing the Medicare, that is insurance and claiming process, Medicare and Medicaid. It includes CPT, current procedural terminologies code, in additional code for CPT, which products, supplies, and services which are not included in the CPT system. In this, level 1 is CPT, level 2 is National Alphabetic Code is added externally. And the next one is natural drug code, is a unique identifier for medication which include prescription and overall counter drugs, which facilitates the electronic transmission of drug information between manufacturer, pharmacies, and payers. The NDC format consists of 10 digit with a 3 segment number. Let's see with an example. Example of NDC number is 12345. It's the first segment. Next one is 6789. Second segment, and last segment consists of 2 digits, 0 and 1. Can be broken down as follows. The first 5 digits with the first segment is a labor code, which is for manufacturer, and the second 4 digit code, that second segment is the product code, so mainly for specific drug formulation. What are the drugs included in that? What are the formulation included in that? And the next third segment is 2 digits, which is for a package code for transforming from one place to next place. Next thing is SNOMED CT, systemized nomenclature of a medicine. Is a comprehensive clinical terminology which provides a common language for exchanging the clinical information from one place to another place, and which is used to code a clinical terms, concept, relationship in e-health records, widely used for a clinical documentation and for better interoperability. And the next one is LOINIC, logical operation identifier names and codes, which is for identifying the laboratory and clinical observation, facilitates the exchange and integration of e-health records, commonly used for laboratory results and clinical measurements. And the next thing is UMLS, Unified Medical Language, which is a compilation of biomedical vocabularies with a standardized code. It aims to improve the interoperability and understanding of diverse biomedical vocabularies. What are the components used is terminologies like SNOMED, CT, ICD, and other codes are also included in UMLS. International Classification for Nursing Practice, ICNP, which is a standardized terminology for nurses' diagnostics and intervention. It supports documentation and communication for nursing care. The main usage is in nursing field. RX norm is a standardized nomenclature for clinical drugs and drug delivery services, which provides a normalized naming system for medication and to enhance the interoperability between the system. The components which are included is a unique identifier for each drugs, digital imaging and communication and medicine, DCOM. DCOM is a standard for exchange of management medical devices and related information, which also ensures the interoperability among different imaging devices and systems. Thank you.